Hey, regarding the neurocysticercosis case, there was a question about why the family reacted the way they did. Like, did they know? And that was the point. Yes, it's very common in certain groups, right? Because families or groups of people, they do the same things, they eat the same things, and so they experience the same things. And so when I was talking to this group of people, which happened to be family members, they had other family members that had already had this disease, and so they were aware of its effects, basically. Cysticercosis is actually a not that uncommon. I mean, it's in many parts of the world, and it is transmitted through undercooked or underprepared meat, particularly pork. This particular case was in Los Angeles. I actually trained in Los Angeles, and so this was a case that I had when I was in Los Angeles, so it was not in a rural area or in a developing country. It was right in the middle of Los Angeles. So this is not something that is only seen outside of the city. So as I mentioned, humans get this disease basically by consuming undercooked pork that is contaminated with this tapeworm and the cysts of this tapeworm, and they eat it. And as I explained, it kind of goes through their GI tract and kind of finds a home in their muscles and their brain. Another question that was asked is how long before a patient develops this. So I eat a chorizo from a taco truck and it's the best thing ever. How long do I wait before I realize that this was a bad idea or it was okay? Typically about 3 years, maybe a little bit longer, maybe a little bit less, but it's a period of time, right? It's a minute before, you develop symptoms after eating the contaminated food. I was also asked, how can we prevent this aside from not eating pork? And one way is to examine your meat, examine your pork for cysticerci. Cysticerci are visible in raw meat. Another way is to freeze your meat or make sure that you cook it well. And there is a possibility that humans can have this chronic infestation of tapeworms and actually are the reservoirs for this tapeworm. So having hygiene and sanitation that addresses the spread through fecal-oral routes of the tapeworm is actually effective as well. I was asked a question about treatment for this. Well, of course, in the emergency department, our primary concern is handling any seizures or headaches, visual changes, or anything that's happening acutely in an emergency type of presentation that may be immediately life-threatening, of which there could be several things going on. So we want to make sure we stabilize the patient first. So that's what I do in the emergency department, is stabilize the patient. After that's done, then we can move into eradicating or trying to eradicate the worm, right, the organism. So one of the interesting things about some parasites, worms, and some types of bacteria and, some other organisms is that when you go to kill them, they don't die softly. They don't die quietly. They release a lot of inflammatory mediators, which means that they basically set everything on fire as they're dying. So it causes a tremendous amount of inflammation in our bodies, especially in the area around where the bug is living. So we want to be careful when we're treating that we don't set a storm of fire into areas that are very, very sensitive, like the eyes, even the brain, where we treat without considering that the death of these organisms is going to cause a basically shitstorm of things to happen. So the medications that are often used to basically kill the parasite are praziquantel and albendazole. And these are given and basically they directly attack the worm. So again, you treat the emergency situation obviously first, and then you consider that this inflammation may cause more harm than you anticipate, so you get yourself ready for that. And then after all that's done, then you go into these more definitive, specific treatments to actually attack the microorganism itself. So I hope that helps answer some of the questions that was asked in the comments. I don't have time to go through and answer all those questions one by one, but I do aim to provide a comprehensive view of what we're talking about. So I hope that helped.